When I come back to Chinese medicine, this is a diagram of a meridian, this line coming down this fellow's body, in which qi or energy flows. These meridians have names such as lung or spleen or gallbladder, which are not directly connected to what we think of as those organs, but flows of energy through the body and connected to the universe around us. By manipulating the qi, the points, these acupoints on the meridians, in Chinese medicine it's believed that we can increase or decrease qi, and that can affect health. It can promote wellness and treat disease. There are certain acupressure and acupuncture points that can be used to treat allergic disorders and asthma. Often in Chinese medicine, not by itself. Acupuncture in Western medicine is a modality done often by itself, but in traditional Chinese medicine it is used in combination with either massage and or herbal medicine as a plan of treatment. Even in young children, massage or tuina is used and as one of the forerunners of infant massage in this country. And many of these therapies can be used in young children if done by a skilled practitioner. Let's turn to manipulative therapies, which include chiropractic, osteopathic, and massage therapies. Interestingly, in one study done in the Boston area several years ago, it turns out the parents brought their children to more visits to chiropractors in a given year than to their primary care pediatricians. Chiropractic is the most widely used complementary alternative remedy in the United States in many studies, and historically there has been a great rift between chiropractic and conventional Western medicine, mainly for economic and historical reasons. There are many chiropractors who specialize in working with children, and I personally, in my practice, do work with families who work with chiropractors, and we have a very good relationship. And again, it goes back to all of us working together to do what's best for the child. Osteopaths are trained they have DO degrees typically. They're doctors of osteopathy, which is a 4-year medical school program. And they do in their training learn about body manipulation. Many these days practice just straightforward medicine, but others have kept the osteopathic manipulative therapies in their practice. And massage therapy, of course, is not just in spas, but also used therapeutically in hospitals, even in neonatal intensive care units. Spend a minute speaking about mind-body therapies. There have been some very interesting studies looking at the use of things like self-hypnosis, meditation, and biofeedback in treating allergic disorders, especially asthma and breathing disorders. This Chinese woodcut block print here shows famous General Hua Tuo playing a game of Chinese checkers, simultaneously being operated on by his surgeon here. It's one of the first depictions in art of a mind-body therapy. He is using the game to distract him from the pain from the surgery. Now, fortunately, these days we don't rely upon that without any other treatment, but it is very interesting to know that for pain control, we have many studies showing the effectiveness of these therapies, both in private office and hospital settings. Interestingly, though, many of these therapies are now being used to help with breathing control. And if you think about yoga as one of the classic mind-body therapies, breathing is so crucial and can actually help with people who have trouble with asthma attacks or trouble breathing from allergic rhinitis. We can teach better breathing patterns when people are feeling well or not struggling as much so that they can use it when they are having difficulty. Other approaches that I do want to touch on before we get to questions, because we will have plenty of time for questions, and I can come back to any of these areas that you'd like, so you can start writing in your questions if you haven't already. Just the concept of environmental control, washing off pollen. When you look around, those peak pollen times, you see the green stuff filtering all over the cars and your clothing and kids' clothing, and they come home from school, it's in their hair. Simply washing it off can help. Washing their hands, washing their faces, washing their hair, changing clothes can make a big difference for some children in reducing exposure. HEPA air filters are air filtration systems that have come down in price that filter out particles in the air, and they can be placed in key areas like sleeping areas in the house to filter air particles that are unhealthy, like mold or pollen that can come in the house, or pet dander. You have to just remember to clean out the filter regularly. And what this woman is showing you on the screen here is the use of a neti pot. A neti pot, or NETI, is a system of using saline or salt water to rinse out congestion or pollen through the nasal passages up through one side and back out the other. And it looks pretty simple in the picture. Usually advise people to do it over a sink, but believe it or not, we even have children as young as 2 or 3 years old who can master this. The devices they use are more like squeeze bottles that they can squeeze, and the saline just pumps in and out. There's some pretty cool YouTube videos you can look up about how to use a neti pot with children. Again, you'll see some really young kids doing it and actually sort of giggling through it. Can be effective. Again, some kids and even their parents cannot tolerate this, but it is one thing to consider. So in conclusion, I'm going to leave, I think we have close to 10 or 15 minutes left for questions. And again, I can go back to any of these areas. I like to close with something humorous, which puts together everything we talked about. You have a grandmother here sitting knitting with her granddaughter, sipping her tea, very old-fashioned by the hearth, saying, "My dear, may I suggest a little old-fashioned biofeedback, some acupuncture, and a dollop of nutritional counseling?" And so when we talk about integrative medicine, it's many of these things that we're putting together. All of these, have some role, as we talked about tonight, in allergic disorders and treatment. And I hope that I've left you with some ideas to look further into natural remedies and what I call about going back to the future, that really the future of healthcare and medicine is prevention. And many of these time-tested things that our grandmothers taught us about, paying attention to the food we eat, the water we drink, the air we breathe, our lifestyle choices, good nutrition, healthy exercise, relaxation, free play, all of these really important things. And if we get back to basics, I think those things will make a bigger difference for our health than any of the really expensive modalities we spend a lot of time and money on. So I'm going to stop there, turn it back to Sarah, and we'll start fielding questions.